السلام عليكم ورحمة الله وبركاته. I'm دكتورة صفاء صلاح الدين, pathologist. I'm with you today to present the testicular pathology. Testicular disease includes cryptorchidism, this means undescended testis, testicular torsion, orchitis, varicocele, and hydrocele. We'll discuss all these topics inshallah. Testes are the component of both reproductive system and the endocrine system of the male. The primary function of the testes are to produce sperm, and this is called spermatogenesis, and the production of androgen and primary testosterone. Blood supply for the testes is by testicular artery. This is the anatomy of the male genital organ. This is the urethra here, and this is the testis in the scrotum. Look, the urethra extends from the opening of the penis and pass through the penis until reach the prostate, cross the prostate, and then enter the bladder. Here the testis in the scrotum, attached to it the epididymis, and the epididymis pass through the vas deferens until the seminal vesicles attached to and the bladder, the position in front to the prostate. Okay, this is the picture of the histology of the normal testis. This is a picture of the normal testis. Look to the shape of the normal seminiferous tubules of the testis. The outer layer of it is cells, and the inside cells is spermatogenetic element which produce the sperm. Around the seminiferous tubules, the stroma, which include the interstitial cells of the Leydig cells. Okay. Types of cells: seminiferous tubules, stromal cells contain Sertoli cell and Leydig cells. Cryptorchidism means a abnormality in which one or both testes are not in the scrotum by the end of the first year of the age. Affect 1% of male population. It is most common birth defect of male genitalia. In 10% of patients, it may be bilateral. Normally, the testes descend from the abdominal cavity into the pelvis by the third month of gestation, and then through the inguinal canal into the scrotum during the last 2 months of intrauterine life. The etiology can be congenital or acquired. Congenital, the cause may be hormonal and mechanical factor involved. If there is defect in fetal androgen or excess maternal estrogen, or there is a local causes. Acquired, it is caused by post-operative trapped testis, iatrogenic. Pathology classified according to the site of the arrest into the undescended testis to abdominal, inguinal, upper scrotal, or ectopic, that means outside the scrotum. Clinical features: empty scrotum, infertility if the patient presented late in the life, when in old age, not in childhood. Azoospermia, that means there is no sperm, or decreased fertility, oligospermia, or either presented by germ cell neoplasia. There is marked risk of neoplasia if the undescended test is not treated early. Observe this morphology of the undescended testes by the microscope. Look at the difference between the normal picture. We saw it in the last picture. Look to the very atrophied testes, grossly small atrophied. They thicken in the wall of the seminiferous tubules. Look to the difference of the wall of the seminiferous tubules. There is maturation arrest, and there is stromal fibrosis. there is fibroblast in the stromal cells. Stromal management, surgical placement of the test in the scrotal and scrotal sac, and this operation called orchiopexy should be done maximum by the age of the 18 month. If not treated, the complication, testicular germ cell neoplasia and testicular neoplasia, can lead to testicular torsion and can lead to infertility. Another pathology for the testis is testicular torsion, in which there is twisting of the spermatic cord, which disrupt mainly the venous supply to the testis, and the arteries, usually patent, that lead to intense vascular engorgement and venous infarction follow. Predisposing factor for testicular torsion, either violent movement or physical trauma. This picture for testicular torsion. There are two types of testicular torsion, either neonatal or adult. Neonatal torsion occur either in utero or shortly after birth. There is no associated anatomic defect. There is no anatomic defect in neonatal torsion. But adult torsion affect mainly adolescents. In contrast with neonatal torsion, usually there is bilateral congenital anomaly in the adult torsion. Also, the testis can be affected by inflammatory conditions. Inflammatory disorder of the testis, acute and chronic, are frequently associated with involvement of the epididymis, and this is called epididymoorchitis. Most of them are related to urinary tract infection by means of the retrograde spread through the vas deferens. Less frequently, retrograde venous or lymphatic spread account for the gonadal inflammation. Gram-negative organisms are most frequently found because the gram-negative organisms is the most common organism that can lead to urinary tract infection. That means can lead to epididymoorchitis. Etiology. Among sexually active men of less than 35, it is most prevalently caused by sexually transmitted organisms like Neisseria gonorrhea, Chlamydia trachomatis, and Ureaplasma ureatica. Bacteria involved in the urinary tract infection, such as E. coli, Pseudomonas aeruginosa, Klebsiella, mainly found in men over the age of 35. Less frequently, acid-fast bacteria, fungi, actinomycosis, and spirochetes syphilis diagnosed underlying cause of this epididymoorchitis. Also, viral orchitis, which means inflammation of the testis due to viral infection. The most common agent is mumps. Postpubertal mumps in males is associated with 40% likelihood of orchitis. That means 40% of males affected by mumps can lead to orchitis. Clinical features of inflammation: testicular pain, swelling, and fever. Bilateral symptoms occur in up 25% of cases. Clinically and radiologically, the inflammation resembles a testicular neoplasm. If we saw it radiologically or clinically, may mimic the testicular neoplasm. When caused by the mumps virus, they can preceding salivary gland enlargement, tenderness, and pain. Viral orchitis can lead to subfertility. Severe testicular damage can lead to hypergonadotropic hypogonadism because there is testicular damage with low testosterone level and regression of secondary sexual characteristics. Treatment, because it is viral infection, supportive, and treatment include mumps vaccination. Varicocele consists of an abnormal dilation and tortuosity of veins in the scrotum. It is usually left-sided and developed during puberty. The patient may or may not that has abnormality in the scrotum. Sometimes the patient feels a large varicocele, which have been described as a bag of worms. At other time, it is recognized incidentally during infertility workup. Maybe discovered accidentally during infertility workup. The varicocele is the result of faulty or absent venous valves. Hydrocele This is an abnormal collection of serous fluid in the tunica vaginalis. Tunica vaginalis is the serous membrane surrounds the testis and the epididymis. When there is collection inside this membrane, when the collection is serous fluid called hydrocele, it may be acute or chronic, congenital or acquired. It may be idiopathic or response to infection or tumor. Or hematocele, that means there is collection of blood in this tunica vaginalis. Or chylocele, that means collection of pus inside this tunica vaginalis. Fee and decreased fertility can affect the testes. The cause of dystrophy may be progressive atherosclerotic narrowing of the blood supply that is in old age males, or end-stage inflammatory orchitis, or undescended testes, hypopituitarism, that means there is low level of pituitary hormones, generalized malnutrition or and irradiation. If there is prolonged administration of anti-androgens, for example, that used in treatment of carcinoma of the prostate, or there is cirrhosis of the testes, or primary failure of genetic origin like in Klinefelter syndrome. That is all, and good luck. Wassalamu alaikum warahmatullahi wabarakatuh.